students. Welcome to the second part of the introduction to periodontics class. So before I talk about the other contents in Carranza, a quick brush up of what we did last time or what I spoke last time. So see this diagram. Okay. So this is the tooth, this is the cemento-enamel junction, this is the gingiva, this is your alveolar bone. Okay. So in Carranza, most diagrams that you see will be from here onwards. Okay. There will be this line. Okay. Which here you have to understand this is the tooth and this is the gingiva and this is the root portion that we are talking about. Okay. Now I will share another video of some patient details and then again I will talk about the remaining contents in Carranza. Okay. Good morning students. Welcome to the second portion of introduction. Okay, so last class I told you regarding the normal structures of gingiva, then I told you regarding the etiopathogenesis of periodontal disease. Okay. So now you know that there is something called as the calculus which acts like the hub for the microorganisms and this calculus has to be removed. Okay, only if you remove the calculus will it help to remove a lot of bad microorganisms. Okay, so now a patient has come to you and he's having severe pain on one tooth. Okay, what will you do? Will you tell the patient, okay, I think we have to remove the calculus first? No. For every patient, whatever the emergency has to be addressed first and eventually further treatment has to be done. So for this purpose, it is important that you make a treatment plan. Okay, you have to make a treatment plan as to what treatment you are going to do first, what treatment you are going to do next. Okay, so when you make the treatment plan also has to be very realistic. Okay, you cannot, if the patient is telling that his tooth is very much mobile, you cannot say that, okay, I'll nail it there. It's not possible. Okay, so you have to assess various factors, okay, like the age of the patient, the amount of bone that is remaining. You have to assess various factors and you should categorize it like the prognosis. When you do the treatment, will it be good? Will it be bad? Will it be fair? Okay, so you have to diagnose the disease first of all. Okay, if there is, what exactly is the disease? If there is bleeding, if there is pocket, what exactly is the disease? Diagnosis of the disease is important. Prognosis is important. If you are doing some treatment, is it for the better or not? Okay, so the prognosis is important and the treatment plan is important. Which treatment to do first? Okay, so the next section of Carranza deals with the diagnosis, prognosis and treatment plan. Next is the management of patients with periodontal disease. I told you if the host immunity is even otherwise compromised because of certain diseases, then what are the treatment changes that you will do in that patient? Okay. First of all, you have to know treatment क्यों करते हैं? Why to do treatment? Okay, so for that, I'll first tell you that there's this study conducted by one of the pioneers in periodontics. His name is Lowe. Okay, Lowe, L-O-E, Lowe et al. He did the study on Sri Lankan tea workers. Tea workers from Sri Lanka, Sri Lankan tea workers. So what did he observe? He observed that they didn't brush their teeth, they didn't use any mouthwash, they did nothing. Okay, and he found that in such people there was lot of gingival inflammation. Okay, whereas he observed another group, Norwegian academicians if I'm not wrong. Okay, they always did plaque control measures. Okay, like brushing, flossing and all those things, and the chances of gingivitis in them was like almost nil. Okay, so what is the one conclusion that you found out from this? If you practice proper plaque control measures, then the chances of the microorganisms progressing and growing and further causing disease is reversed or reduced. Okay, so that is one thing. Plaque control measure is thus important. Second thing that he did, second conclusion that he drew from this study was that many conclusions he drew. Second conclusion which he drew was that not all cases of gingivitis progress to periodontitis. Okay, so in those tea workers also who didn't practice any plaque control measures, in them also only some of them had further periodontal destruction, alveolar bone loss, mobility. Okay, only some of them had problems which were so severe. For most of them, it remained as gingivitis. Okay, so because of all these reasons, where was I? Yeah, so we were coming to plaque control measures. Now, this plaque control measures is what? Brushing, okay, flossing, using mouth rinses, and also you do a procedure called as oral prophylaxis, which means with the help of certain machines, ultrasonic scalers, you remove the calculus, and once the calculus is removed, a lot of microorganisms are also gone in that. Okay, so thus came the procedure of ultrasonic scaling. Okay, further it was noticed that, yeah, one more point I'll tell you. We spoke in the last video as to how host plays an important role in the disease mechanism and all that. Okay, there are certain host modulation techniques, which means what can you do to help the host fight against these microorganisms better? What can you do to help the host fight against these microorganisms better? Okay, so that is host modulation. So now the next portion of Carranza deals with plaque biofilm control, scaling, ultrasonic scaling, and host modulation therapy. Okay. Now the next segment of Carranza is regarding surgical procedures. What is the surgical procedures? See, I told you your gums are there. Okay, gingiva. The gingiva, there is destruction that is taking place and it has progressed further inside into the level of your alveolar bone. So what do you do in surgical procedures? You do many things, but the most important thing that you do is periodontal flap surgery, which basically means that you will make incisions or cuts on the gingiva, you will reflect the gingiva, you will remove all the bad products, all the granulation tissue from here, okay, and you will suture this back. This is simple flap surgery. Okay. Now what else can you do? If there is excessive bone loss over here, you can add certain bone graft particles or bone graft products which will help to regenerate the alveolar bone. Okay. There are also subtractive techniques like resective osseous surgery, which means if the defect is such that if you remove some more amount of alveolar bone, it is better for the healing. Okay, so that is resective osseous surgery, which is very difficult to understand right now. Eventually, we'll talk a lot more about it. Okay, so then there are regenerative procedures, there are resective procedures which are done, or there can be just a simple flap surgical procedures. Okay, now other than that, even flap surgery or even other periodontal surgery, there are a lot of advancements in the different types of things that you use for doing surgery. Like there is laser, there is microsurgery, and there is tissue engineering. All these are advanced treatment modalities that we use. Okay. Now the next section deals with interdisciplinary management, which means if there is an endo problem and there is a perio problem for the same patient, then how will you manage such cases? How will you manage an endo-perio lesion? Okay, how will you manage an ortho-perio lesion? Okay, resto-perio. So, if different disciplines are involved, then what is the strategy for managing them? Okay. Now, the second last is something very important. Supportive periodontal therapy. Okay. Which basically means that now if you are doing, if a patient is come and you have done, so supportive periodontal therapy means if a patient is come, okay, and you have done very good treatment for that patient, and if the patient goes back but he doesn't maintain his oral cavity well, he doesn't do proper plaque control measures, so then whatever you did, it will not really benefit the patient much. Okay, so for that purpose you have to have, so if you have done like really good treatment also, if the patient is not maintaining his oral cavity well after that, then it's really pointless, because again there will be disease and again there will be problems. So you must follow the patient for long intervals even after your therapy, whatever treatment you do. Okay. Now next, coming to the last phase, which is dental implants. Okay, dental implants basically means that if the tooth in one area is missing, okay, you drill into the bone in that area and you place a titanium screw, and after you place the titanium screw and after the tissue is healed, you place a crown over it. Okay, so that is dental implants. Okay, uh, in dental uh, in dental implants also, that is like a separate section in itself. What In which cases can you place dental implants, in which cases you cannot place dental implants, what are the complications if you place dental implants, what are the stages, what is the maintenance of an implant like. So that is a separate session altogether. Okay, so I hope in these two videos I am able to tell you maximum in a nutshell what periodontology is all about. Okay, so you can go through Carranza, you can check the headings at least, so that you know how everything is linked together. Okay, I'll be uploading more theory class videos. Hope it helps you. Bye.